channel. Today I've got a different type of video for you, and it's going to be the truth about being a dental nurse. So for those of you that don't know, I work as a dental nurse. I've been in the job now for, it will be 4 years this coming September, and I'm going to be doing for you like the truth about it. So what the best parts are, what the worst parts are. So if you're interested in seeing that video and hearing about my experience with being a dental nurse, then just keep watching. Okay, so I'm going to do this in like different categories. So the first one is going to be the gross things. If you don't like gross things, then just skip ahead on this video or click out of it because they're going to be pretty in-depth. But let's just get on with the grossest bits about my job. So whenever somebody asks me what is the worst thing about your job, one thing mainly comes to mind, and this probably isn't the worst part. I'd really have to think about that, but it's definitely one that always sticks in my mind, and it is at the end of the day when you have to clean out the spittoon. Now the spittoon is the little sink next to the chair that you spit in, and at the end of the day we have to pick that filter up and put it in some bleach. Now that might not sound too bad, but you know when you crack an egg and all that gooey clear stuff comes out, that is what the filter looks like when you lift it up. And that is everybody's spit all stuck to it. That is the main thing that really makes me gag as part of my job. It's disgusting, it's gross. I have figured out a way to reduce it and make it not be so thick and stringy. It literally makes my jaw just like tighten up. It's so disgusting. So what I normally do is throughout the day is put the tap on really hot and do about 4 or 5 cupfuls of hot water and pour that down the spittoon, and it kind of breaks up all that saliva that's in there. It's disgusting, I know, but it makes it a bit easier when you lift it up at the end of the day. It's not so horrible and disgusting. Another bit of the job which is really gross, I don't know about anybody else, but you know when you put your hand in a sink and like you touch food and it just makes your whole body like cringe? That is the feeling you get when this next thing happens. So sometimes when you're like suctioning somebody's mouth, bits flick up, and you're not allowed to wear long sleeves in a clinical area because actually, I don't know why. I'm gonna have to Google that, hang on a second. Right, I've got it, and I should have known this before because now I read it, I'm like, oh yeah. So it's basically so that you can do like a clinical scrub on yourself when you wash your hands. You should be going up your arms as well. And obviously with long sleeves on, you can't do that. So they need to be short sleeve tunics is what most dental practices wear. So going back to the gross thing is when bits flick up, sometimes they land on your arm. And this is really disgusting. So sometimes it could be blood, which is minging. Sometimes it might be a bit of old filling. Sometimes it might be a bit of tooth, and sometimes it might be a bit of food or plaque. That is just so gross because most of the time you see it like flick out as well, and then it just goes plop, and you're there like you can't say anything or do anything because you're suctioning this patient's mouth, and you can't help but look at it either. So you're like, it's on my arm, it's on my arm, it's on my arm. And you feel like you're just never clean afterwards. It doesn't matter how many times you try and scrub that area or disinfect it, you just don't feel clean. And even after a shower, you still feel like it's partly on you. A lot of the time as well, the stuff that flicks up is actually when the dentist uses that that water spray. And if it's on a lot of them are hard jets as well. So it will hit the tooth and then like spray back, and you do get a shower. I will admit you get a huge shower of water, but you know it's not just water because it's hit the tooth first, so all the crap that is on that tooth has just hit you straight back. Oh, it's gross. This next one for another gross thing is like there's certain sounds that just again make your jaws, you know when like you eat a sour sweet and your whole face goes like, that is kind of what happens when you hear certain like sounds in the practice. So one of them is when you get like a really salivary patient and the dentist says, can you suction? you know you're not going to suction the water out of their drill because they haven't used it. You're going to be sucking like pure saliva, and the sound that it makes is like a, it probably doesn't sound that gross telling you about it, but you can like feel stuff go up the suction as well, and it's that sound of that like, and then you feel it pass through the suction and down the tube, and it's just, I hate it. It's really disgusting. I hate it. Okay, and for my last one of the gross things, believe me, there is a lot more than this, but to keep this video as short as I can, I'll just do kind of the main ones. So the next one is the sludge drum. And what the sludge drum is like a bin, and it's full up with all the crap stuff that's collected through the suction and is too big to go kind of through the filter, and it all collects in like its own little filter. And at the end of the day, you have to take this filter out and like bang it into the drum to get all the bits off, and it smells disgusting, it looks disgusting, and if something falls onto your hand, even though you wear gloves, it's just gross. And that is everybody's crap throughout the day that's collected on here, and you have to take that out and put it into the sludge drum bin. That is a disgusting thing to do. So I'm going to move on to the next section now, because like I said, I don't want this video to be too long. So I'm going to go on to the best bits about this job. So one of the things that I like most about my job is that sometimes, not all the time, you will get a really, really nice patient, and that makes your day so much better, because the amount of people that are actually really horrible to you in that place, not staff, I mean patients, like sometimes you can't believe how rude they are. So when you get a nice person, it makes your day, it makes your week sometimes. And that's one of the best things about the job, is that when you can engage with a really nice patient, and a lot of the time they'll be elderly and they'll be telling you stories about their life, and it's really interesting, and you can talk to them and you can have a conversation with them and just enjoy their stories, and they'll ask you questions. How's your day? How's your week? How are you doing? And you get to know them as well. So when somebody comes in that you know, but you know through the job, then you know, you feel like you give them the best service you can. Like with every patient, you give them the best service you can, but when it's someone that's really nice to you, you feel like you give them that extra bit more. So always be nice to your dentists and dental nurses and your dental receptionists, because we value it. Another thing that's quite nice about my job is that when you give somebody like the smile that they want, they are so thankful for it, and them, you can see how grateful they are, and that's a really rewarding thing, to have them be like, thank you so much, you've been so helpful, that was really nice. And you can see how happy they are with now how they look, and this could be anything tiny from like a chipped front tooth and you've made it better, to giving them braces and they've got a whole new smile at the end of it. Another great thing, and this doesn't happen very often, but when it does, it just makes you feel so much better about yourself, and that's when somebody, like a patient, will ask you for your name, and they will make a point of either emailing the practice or sending a letter or doing something to say, this person was really helpful, they were really nice to me. And I've had it, I think, twice or 2 or 3 times now, where, you know, somebody's either phoned up or told somebody else that I've been really helpful, and it makes you feel that much better about yourself and know that I am doing my job well, and I'm trying to do my job well, and people see that and they're thankful for it. And the last thing that I'm going to say that I really love about my job is that when we get small children in, a lot of the time they are scared of the dentist, which is understandable. I used to be petrified when I was a kid. But you can talk to them, and most of the time they will calm down and they will see that you're just there to help them. And I like trying to help them and teaching them things, or like I'll kneel down with them and I'll say, can you put the special glasses on, and that makes them think they're special because they're getting the special glasses. Just little things like that with children that I love. I love kids anyway, they bring me a lot of joy, but when you're teaching them something or telling them something or helping them with something, you know that you've made a difference in their day, or it's something that they will now remember. Or even giving them a sticker, it makes them light up and they get really excited about it, and then they're that little bit less scared of you, which obviously you don't want anybody to be scared of you. We don't want to be scary people, but talking to them and acknowledging that they are there and they are a person and they can talk to you if they want to, I think it just relaxes them a bit more and it makes them feel more comfortable about being in that environment. So now I'm going to move on to the worst bits about being a dental nurse, and this is leaving aside like the gross bits because I've already covered that, but the worst bits about the job. And definitely number one is how rude some of the patients can be towards you personally. Even if they say, I'm not blaming you, but they're like shouting at you at that time, so you do feel personally attacked by them. That's definitely the worst thing for me anyway, is being like personally targeted, to be shouted at sometimes, or told that why they have to do this, they don't want to do this, or a mistake has happened that may even be their fault, but they're just blaming you for it all. Obviously you do expect that because people they're just rude, but it's just not nice being personally attacked for it and being shouted at, and it does stay with you as well a lot of the time. Some people can like palm it off, but for me, if someone is really rude to me, that does stay with me for the rest of the day, and it just puts you in a bad mood. They don't like being asked to do things or to fill out forms. They don't see why they need to do it. They have a go at you for it. You do get complaints, you do get people whining at you over the phone especially. You get people having a go at you. Why have you not picked up the phone? Why have you not done this? Why have you not cancelled my appointment? All stuff like that. And a lot of the time the answer is because we've been really busy. I couldn't pick up the phone because I had somebody in front of me that I had to deal with. I can't just say, hang on a minute, pick up the phone and have a 10-minute conversation with you. It's difficult. It's really busy most of the time, and it's good to be busy, but people tend to think that you see one patient, then you have like a 20-minute break, and then you see another patient, then you have another break. It doesn't work like that. You are back to back constantly. You're lucky if you get a bit of a break apart from your lunch break during the day, because you're constant seeing to people, which is good, but more people need to understand that's how it works. It's not that you see one person, then you've got room, and then you see another person. You are back to back with appointments. Again, this is just a general dental nursing job. This isn't specific to my practice. It is in general. I've worked in 2 different practices, and it's both like the same, the pros and cons of the job, not specific to the practice. But this next one is that you, as a dental nurse, you've got to be constantly on the ball. Like, you can't be thinking about anything that's happened outside of work. You can't go off in a little daydream, which I know you can't really do in a job anyway, but you have to be listening to what's going on behind you. If you are upset about something, obviously you're entitled to be upset about something, but you've just got to, you can't be on your own in the day, if that makes sense. You have got to be focused, precisely focused on exactly what is happening, what the patient is saying. You've got to concentrate on what's going on. You need to do things right. You can't afford to make a mistake. You have to preempt things, and it's difficult. When you're that busy, you're flipping between one thing and another, and that can be really difficult. And at the end of the day, you feel exhausted, or at least I do anyway. If you've had, especially if you've had a million, well, that's a bit of an exaggeration. If you've had a lot of emergencies in that day as well, your brain just feels completely fried from dealing with all of that. Apart from those 2, there isn't really that many bad things about the job. It's mainly like the gross things. If you're going practice specific, then that is the only bad things about my job. It's nothing to do with the practice. I love where I work, but I'm sure a lot of dental nurses might not love where they work, and they would have a lot of other bad things to say, but that would be practice specific. This for me isn't. That is the only bad things, or they're not even that bad, but the only cons to my job are those 2, apart from the gross stuff. So that is pretty much it for my video today. If you guys want more of an in-depth video about exactly what my job is and what I have to do, then let me know, because I might do one of those soon as well. I'm not sure yet, but if you want one, then just let me know. If you like this video, don't forget to give it a thumbs up, click that subscribe button down below, and I'll see you in my next video. Bye!